Good morning, everyone.
Good morning.
And thank you, Brian, for that introduction. Brian and I did not coordinate our talks, and so as I was looking at his slides, I said, oh yeah, I said that. Oops, that number doesn't agree with this. So, but I'm really glad to be here this, Sunday morning in August in DC. I would like to join Brian in welcoming all of you here to this conference, and I'm going to start out my talk as well by thanking Louisa Washington, who has served as the project officer from when this was just a twinkling to where we are today, 4 years later, with the culmination in the SYNChronicity meeting. Now, I was really interested when I saw your definition, the medical definition of synchronicity, which chronicity to a clinician means something very different than synchronicity, but when it talked about having a mental vision of something that wasn't already in place, I thought that, that really kind of applies to this whole SNCC project that we had. I would like to say that 4 years ago, we knew that we were going to have a national AIDS strategy and that it was going to say the things that it does say, and that the SNCC project would prepare us to go forward in a very clear way. But I can't take that credit. I mean, we just knew that we needed to. We had the Ryan White providers, and we needed to make sure that we had other providers who were joining us in providing care, which was the whole genesis for the SNCC project. Now, I don't know about you, but I think that this is a fantastic time to be engaged in healthcare and in HIV care. And I'm going to start back in October. In October of 2009, President Obama lifted the ban on people living with HIV traveling to the U.S. and on syringe services programs, and he signed legislation that reauthorized the Ryan White HIV/AIDS program. This month, August of 2010, marks the 20th anniversary of that landmark legislation. And in a couple of weeks, we're going to be celebrating the successes of the Ryan White program, and that's the program that I run, at our biannual all-grantee meeting and clinical conference. In March of this year, the Affordable Care Act was passed, and thus began healthcare reform. And just last month, the National HIV/AIDS Strategy was released, and you'll hear more about that from Mr. Jeff Crowley. I think that all of us can agree that these three are all very significant events. I believe that the interaction of these three events, the passage of the Ryan White Law, the passage of the Affordable Care Act, and the release of the National HIV/AIDS Strategy, presents us with so many opportunities, but it also leaves us with some questions. What does all of this mean for people living with HIV? What is the future of the Ryan White HIV/AIDS program? How will the goals of the National HIV/AIDS Strategy be realized? Now, I'm sure you can add to this list of questions, but I think that going forward together, we'll be able to start generating some of the answers. The one thing that I do want to emphasize, though, is about the Ryan White HIV/AIDS program. That program is alive and well and continues to provide services to over 500,000 people living with HIV and AIDS each year. That's over 500,000 people providing services each year. And yes, you heard Brian talk about the HAB program. In a couple of weeks, we plan to give out more money to states to help with their HAB challenges, those states that have waiting lists, as well as those states that have other cost containment strategies in place, that we will be giving additional funds to those states to help in that situation. I do know also in the Ryan White program that almost 390,000 clients receive ambulatory outpatient medical care from almost 900 Ryan White clinical providers. We believe that many of these clients consider the Ryan White program as their medical home. So whatever healthcare reform brings, there will continue to be a need for providers and organizations that have the expertise to provide high-quality care for people living with HIV. Providers and organizations very much like those funded by the Ryan White program. We in HRSA, HIV/AIDS Bureau, have had a very productive relationship with HealthHIV and its predecessor, the CARE Foundation. Over the past few years, as you just heard, we have funded a cooperative agreement with HealthHIV and the National Minority AIDS Council entitled Supporting Networks of HIV Care by Enhancing Primary Medical Care. Now, I'm not going to go into what all of that entailed because you just saw that on the slides. So let me just skip and say that the purpose of the meeting today and tomorrow is to capture what we have learned from this project so that we can apply these lessons as we move forward to implement the National HIV/AIDS Strategy, the Affordable Care Act, and continue the Ryan White program. So let me just give you an example of how I see this all coming together. And this is just one example. And since all of you are the ones who participated in this, you could probably give this example much better than I. But through the SNCC project, we know that technical assistance and intensive capacity building was provided to, I think you said, over 200 organizations, including community health centers, and I think you said over 250 content areas, okay, including HIV clinical program development, management of HIV, patient tracking with EMRs, linkages and referral, strategic planning, and on and on. The National HIV/AIDS Strategy has set goals for increasing the number of people who are identified living with HIV and linking them to care. Now, the Ryan White program will certainly take care of some of them, but the Ryan White program cannot do it alone. The community health centers, many of the organizations that received help through HIV, will have to provide some of this care. The Affordable Care Act has significantly increased funding for these federally qualified health centers. These centers are viewed as the main safety net providers of primary health care for vulnerable, often uninsured and underinsured people. So as CHCs begin to provide more care for people living with HIV, and you saw that in one of the headlines, through lessons learned from the SNCC project, we already have technical assistance tools and capacity building experience to help them to develop and implement high-quality HIV care and treatment programs. So while the SNCC project itself may be ending, we are continuing our commitment in the HIV/AIDS Bureau to expanding HIV care to racial and ethnic minority populations, again, one of those populations targeted in the National HIV/AIDS Strategy, because we know that they continue to be disproportionately impacted by this epidemic. So going forward, within the coming weeks, we will announce a new cooperative agreement focused specifically on expanding capacity in community health centers to provide HIV care in minority communities. And again, this will be funded with some Ryan White resources, as well as with some Minority AIDS Initiative resources from the Secretary of HHS. So I can't say more about that now because we're still going through the process of selecting who having the Objective Review Committee and selecting who that recipient will be of that cooperative agreement, but that should be out, or has to be out by September 1st. So in conclusion, I and my colleagues at HRSA and HAB are looking forward to engaging with you and others as we move forward together to assure continued high-quality care, treatment, and support services for people living with HIV and AIDS. Thank you very much for having me here this morning. I will be here for the panel, and then I'm going to church. So.